Welcome to this practical training on conducting an individual substance use disorder counseling session. Over the next few minutes, we will explore a professional, member-centered structure covering 5 key areas: connecting with the member, assessing their needs, providing interventions, planning for their recovery, and documenting the service. Effective counseling requires balancing a relational approach with a solid structure. A well-structured session ensures the member feels heard while providing a reliable framework that addresses risks, aligns with treatment goals, and leaves the member with clear, actionable directions for their recovery journey. By the end of this video, you will be better equipped to lead an entire session. We will cover how to open and orient the meeting, perform safety and substance use check-ins, connect emerging concerns to treatment goals, apply focused interventions, and finalize a recovery plan. Knowing your role is essential. As a counselor, your focus is on substance use, recovery functioning, and treatment goals. Work within your credentialed scope, coordinate care when needs overlap with other professional areas, and always consult your supervisor when risks or complexities exceed your training. Our 5-part map for every session is connect, assess, intervene, plan, and document. These steps provide a dependable container for the work. While you may adjust the length of each phase based on the member's immediate needs, following this sequence ensures you remain consistent and purposeful. Preparation starts before the member arrives. Review their current treatment plan, the most recent clinical note, and any outstanding follow-up tasks or safety risks. Having this information ready allows you to maintain the golden thread of their care, ensuring continuity without repeating unnecessary history. The opening minute is vital for establishing safety. Greet the member respectfully, complete any required administrative privacy steps, and open with an inviting, broad question. Practice active listening by reflecting their responses before moving into more directed clinical questions. Core communication skills drive your progress. Use open-ended questions to gather detail, reflections to communicate your understanding, affirmations to recognize the member's efforts, and summaries to keep the conversation organized and focused. When performing safety checks, be direct, calm, and professional. Consistently ask about suicidal or homicidal thoughts, self-harm, and overdose risks. When a risk is identified, follow your agency's established safety protocols, involve your supervisor, and document your actions and the member's responses clearly. When discussing substance use, maintain a neutral, shame-free tone. Explore the details of use since the last session, including substances, amounts, and context, while also investigating what supported the member's sobriety when they did not use. This helps you understand patterns and identify relevant recovery steps. Cravings are data points, not failures. When they arise, discuss their intensity, duration, and triggers. Explore how the member responded to the craving and their current level of confidence. This information helps you build better coping strategies and reinforces that the member is actively working on their recovery. Integrate medication-assisted treatment into the conversation by checking for adherence and any barriers to access. Avoid stigma. Remember that medication supports recovery but does not replace the important work of counseling. Coordinate with the prescriber as needed while keeping the focus on the member's overall wellness. Recovery is holistic, so look at the full picture. Assess daily functioning, including housing, work, and relationships. Identify both challenges and protective factors. Use the member's successes as a basis for further intervention, ensuring you keep the focus on areas directly linked to their treatment goal. After the check-in, collaborate with the member to choose one target for the session. Prioritize safety and treatment plan goals, ensuring the focus is important to the member and realistic for the time available. This prevents the session from becoming scattered and keeps it clinically focused. Finally, ensure you maintain the golden thread in your documentation. Connect the diagnosis, the treatment goal, the clinical target of the session, the interventions you used, the member's response, and the next steps. This clarity proves the clinical necessity of your service and documents the progress made. Motivational interviewing is essential for exploring ambivalence. It strengthens the member's own reasons for change by evoking change talk, respecting their autonomy, and avoiding the trap of arguing for recovery. By reflecting both sides of their conflict, you help the member voice their own motivation, which is far more effective than persuasion. Cognitive behavioral therapy helps make the relapse sequence visible. By breaking down a recent example, you can map the trigger, the automatic thought, the emotional or physical response, the urge, and the resulting action. This collaborative analysis allows you and the member to identify practical points where they can intervene with an alternative thought or action. Relapse prevention is about turning warning signs into action. Help the member map out their high-risk sequence so they can identify early warning signs, reduce access to substances, and utilize support systems long before an urge becomes overwhelming. Crucially, create a plan for a lapse that emphasizes safety and a rapid return to recovery without surrender. Don't just recommend coping skills, practice them within the session. Whether it's grounding techniques, urge surfing, refusal language, or making a support call, rehearsing these skills increases the member's confidence. Remember, the goal is to use the session structure to support your relationship with the member, not to replace it. If a return to use occurs, respond with safety and curiosity. Immediately address any urgent physical risks, then pivot to a non-judgmental analysis of the sequence. Avoid shame or interrogation. Instead, focus on understanding what happened, learning from the experience, strengthening their recovery response, and coordinating any necessary additional care. Before closing, translate insight into a concrete action plan. Avoid vague goals. Instead, ask the member, what exactly will you do? When and where? What barriers might appear? And who will support you? Confirm their confidence in the plan and adjust it if their confidence rating is low. This ensures the plan is truly theirs. Use the final minutes of your session intentionally. Summarize the key patterns identified, affirm the member's specific efforts, and clearly confirm your respective responsibilities for the plan. Preview the next session to provide continuity and ensure the member leaves feeling supported rather than abruptly cut off. When documenting, remember that your note should demonstrate the clinical service, not serve as a transcript. Clearly record the presentation, risk assessment, specific interventions used, member response, and the plan. Ensure you include all required administrative details, using the structure to support the quality of your documentation. Compare vague notes with clinical ones. A note stating only that you talked about stress is insufficient. Instead, document the specific triggers, the interventions used, such as motivational interviewing, and the clear plan that resulted. This creates a golden thread that another clinician could follow to understand the focus and purpose of the session. Avoid common pitfalls that cause sessions to drift, such as interrogating the member with checklists, trying to solve every problem at once, or giving advice before fully understanding their perspective. Be wary of ignoring risks just because a member seems calm, and never document interventions that did not actually take place. When practicing, apply the full structure to a case. For example, if a member admits to high-risk behaviors like driving past a dealer's home, start by connecting and validating their honesty. Then move to assessing safety and mapping the sequence. Finally, collaborate on an alternate weekend plan to keep them safe. In a successful case demonstration, a counselor reflects on the member's risk, maps the sequence of the high-risk event, and then helps the member identify their own solutions. Rehearse the plan, confirm the member's confidence, and ensure they leave with a clear, realistic action to support their recovery until the next session. Until this structure becomes natural, use a post-session checklist. Ensure you covered opening procedures, risk assessment, a focused treatment target, an actual intervention, and a concrete action plan. Reviewing your notes against your treatment plans regularly will help you maintain that essential golden thread in your documentation. The key takeaway for every session is to connect, assess, intervene, plan, and document. Be present, stay curious, keep the golden thread visible in your work, and use supervision early. This 5-part structure provides the rhythm for a professional and effective counseling practice. Thank you for your commitment to this work.